Hi, Dr. Lizano here. Today I want to share with you something that I find to be truly fascinating, something that really passions me, something that I had to retrain my brain in, something that I feel is of great value and that I do and that I share with all my patients is lab work, lab testing, what I call lab interpretation. This is very interesting to me because I want to share with you something that happened to me along the way. I, as you know, went to a conventional medicine school. I studied allopathic medicine. And when you study allopathic conventional medicine, the way that we look at labs is pretty straightforward. As all of you may know, we need and we want all results to fit within a reference range. But something I learned along the way during my functional medicine training is we in medicine do not approach, we do not pay attention to, and therefore we do not dive deep into what is optimal. And that's what I really want to talk to you about today. What is normal and what is optimal? And believe me, there's a huge difference. And this is something that I love explaining to all of my patients because it really is a game changer. It just totally changes the way that we interpret labs. So let's dive into this really fascinating field and see what all of us can learn together. So insulin definitely is one of the top blood markers that we need to pay very close attention to. To understand what these blood markers are really about, we need to understand what they are, what they represent. Insulin is very important for all of us to understand that it is a hormone. It is one of the many hormones that the human body produces, that it makes. Its primary goal is to regulate efficiently how you manage, how you administrate, and how you utilize efficiently your blood sugar. Our cells need gasoline. Our cells need glucose as the first form of energy. And it is up to insulin to regulate and to utilize that glucose efficiently. Glucose cannot enter the cells if it's not thanks to insulin. So this is very important to understand so that our cells can be fed adequately with the right amounts of glucose, sugar levels, gasoline that they need to be able to function adequately. Insulin now, more than ever, we've seen that is a hormone, that is a marker that can elevate slowly or rapidly in time. And if we don't pay close attention to it, we might miss it. Insulin can creep up on you even over a decade. That's 10 years of insulin elevating and elevating before you become pre-diabetic or eventually, hopefully never, diabetic. So this is not an overnight condition. This is not something that just creeps up on you rapidly. This is something that can happen over time and it can cause tremendous harm once it's tremendously elevated. I always tell people, it's like when you go to the gas station and you put gasoline into your gas tank, into your car. What's going into your car is gasoline, but the person who is putting that gasoline inside the car, we can call that person insulin. And this is a great example of how we can illustrate normal from optimal. So just to give you an idea without getting too technical, insulin tends to have a reference range of anywhere from 2 to 24. That's a pretty broad range. And just to give you an example, optimal, very, very healthy insulin levels should always fluctuate around 6.0. So this means that anywhere from 6 all the way up to 24 is when insulin starts to become high, but it's still always within the range. So that is considered in medicine normal. but it's not optimal. Optimal is always having insulin levels around 2, 4, 6, even 8 is a healthy insulin level. Anywhere after 10 or even more, you're starting to develop an onset of insulin resistance.
What does that tell you about my body?
So if I have a patient who walks in, draws blood work, and has levels of insulin 12, 14, 16, 18, 20, I repeat, these patients are considered normal, but they are definitely manifesting insulin resistance, which means they are not utilizing their insulin efficiently. They are asking, they are demanding more of the pancreas. The pancreas, who makes insulin, has to make more insulin to be able to move around all that sugar in your body. And that can start to create a pre-diabetic condition. I definitely recommend that we always pay attention to these levels and make sure they're optimal. So that's the beauty of functional medicine. That's the amazing thing about working in regenerative medicine. We have documented now more than ever that we can scientifically show that we can reverse these conditions. So that's the good news. There is so much that we can do to bring you back from high or pre-diabetic or severe insulin resistance all the way back to optimal. Not normal, optimal. Unfortunately not. It's not a standard of care. It's not a common biological marker that we study on a regular basis. This is done more by certain specialists or under certain conditions, or when patients are now officially not in healthy states. So as a proactive approach, I don't really think many people are doing it, that we should pay more attention to something like insulin in a more proactive manner, for sure. When insulin is high, it starts to create a lot of fat around the abdomen. A lot of the visceral fat, a lot of the fat around the organs is a lot due to insulin, who has nowhere to put all of that sugar because all of the cells already have enough sugar. And so now what do I do with all of this excess glucose? And so it starts to dump it in your organs, around your organs. That's how you get fatty liver, that's how you get other conditions. And then that's how you start gaining weight. And this is why it's really hard to lose the weight. If you're in an insulin resistant condition, losing the weight is going to be very, very hard. DHEA is the primary hormone that starts the family of male sexual hormones. And the interesting part is these hormones are not only for men. Women also make these hormones. So DHEA is what we call a precursor hormone. So it's what starts that cascade of other hormones that the body needs for all sorts of different androgenic functions. Let me explain. DHEA is super important for the brain. It's a mood stabilizing hormone. So it helps with drive, with mood, with focus. DHEA can also increase immune function, and it can also, among its very many things, create testosterone. And testosterone is something we'll talk about later. Yes, DHEA is one of those hormones that does decline with age. So as we age, we have less and less natural productions of DHEA. DHEA is primarily made in your brain and in your adrenal glands. These are two glands on top of your kidneys. So if I find someone in their 30s who has levels who would be similar to a man in his 70s, that means definitely a more rapid decline. This usually happens because DHEA also works hand in hand with another very important hormone that we'll talk about later. It's called cortisol, and cortisol is a stress regulating hormone. So this is definitely someone who is under a lot of stress. So with DHEA and reference ranges, it changes. It's a bit different because DHEA is a sexual hormone. And so these have different behaviors, different ranges. That means with every decade, you have a different reference range. So it's very important that you understand that it depends on what decade of life you are in. That's the reference range that you need to look at. Yeah, so a low DHEA would be a decline in all of those physical, all of those clinical functions that depend on DHEA to work. So if you have DHEA, to give you an example, you might feel that you have low mood. You feel, hey, this is strange. I'm 38 years of age. I consider myself to still be a young person, but I feel sluggish. I feel down. I feel I've lost my drive. And these are very clear signs that DHEA is low. So high DHEA is interpreted totally different. If it's a high, but in the optimal range, then of course that is healthy. That is optimal. Now, if let's say women shouldn't and don't need to have such high levels like men. So when women have DHEA levels that are very high, you're usually seeing things like polycystic ovarian syndrome, metabolic issues that affect women's hormones who become more androgenic, women who have more facial hair, women who suffer from acne. So this clearly not optimal, clearly not healthy. So we've seen now that you can supplement DHEA to improve, to enhance your levels, especially when you have really low levels. It's very important that you understand how these hormones work in a very complex family of hormones. These hormones do not work. DHEA, even though it's in a supplement, is considered a hormone. So supplementing hormones or something that can stimulate your hormone production, you should always be very careful. I've seen many women especially who supplement on DHEA and very quickly start making very high male sexual hormones, and they get themselves in a situation. So what is TSH? What does TSH stand for? So the initials TSH are very easy. They're thyroid stimulating hormone. It's the hormone that comes from your brain, that travels in the blood, comes to your thyroid gland, stimulates the thyroid gland so that it can produce thyroid hormones. This is a very important hormone that is in charge of overall metabolism. It's very important that the TSH is always in very fine optimal ranges, because if you're the CEO of a company, you can't have a large margin of error. So as I mentioned, if you're the CEO of a company, everyone is always going to look up to you, right? Whatever decision you make can expand and become something very big, very fast. They usually range between 0.4 to 4.5, more or less. What would an optimal experts have explained? They say they've shown that optimal levels of a TSH should be between 0.8 and 2.0. This is an optimal TSH value, which is obviously going to represent how well your overall metabolism is doing. We have also seen now, and it's very well documented, women, men as well, who have levels of anywhere from 2.2 to 4.5. Remember, this is still within a normal range, can start to have signs and symptoms of a low, I call it, a sluggish thyroid. So that means your thyroid function in your body is slower than it should be. So every function that the thyroid is in charge of will do this. And so you will officially start to fall into the category of very slow thyroid function. This really matters because it can and it will affect many important metabolic and biological systems. TSH is the one main marker, but it's not the only marker that establishes healthy or optimal overall metabolic health. It is very important. It is crucial that TSH establishes optimal metabolism. If not, you can have a hypo, very slow thyroid function, or you can have a hyper, very fast thyroid function. And that can also be another problem. So optimal thyroid conditions are in general in charge of having overall optimal health. Something that a lot of people miss is they sometimes get stuck only on the TSH. And it is very important to understand, it's like paying attention to the CEO of your company and ignoring the rest of his team. And one thing I recommend that people do is always look at antibodies. No one should be making antibodies against your own body. That's what antibodies mean. Sometimes we see fluctuations in TSH, but no one is asking why, as we ask in functional medicine. I invite you to pay a lot of attention to this and to always dive deep into a comprehensive thyroid function approach. Cortisol, people need to understand, is a very important hormone that all humans make. Cortisol was designed to keep you active, to keep you on your feet, to make sure if there was ever any attack, you're alert, you're ready to go. So cortisol nowadays, because we're under so much stress, and we now know that cortisol is the stress by excellence in the human body. It's the stress regulating hormone. So it is very important to understand cortisol is a very important hormone for everyday human function. So there's something very interesting once you dive into the specifics of cortisol testing and to understanding the cortisol function. We make cortisol at different points during the day naturally. So we now know that there are 4 points during the day when you are making cortisol naturally more so than the rest of the day. At the beginning of your day, in the early morning, around midday, mid-afternoon, and then at night. So with that said, we now understand what a cortisol awakening response is. Cortisol awakening response is what helps you to start your day. So this is very important because this is when your cortisol naturally should be its highest. And when you look at it in the reference range, it should be in the middle of the reference range. So a reference range, a healthy reference range, more or less, again, I repeat, depending on labs, because they tend to change just a little bit between labs. But normally it's 5 to 25. And a healthy morning cortisol should be around 11, 12, 13, 14 should be tops. That's a healthy morning cortisol. So if you're having a low cortisol level, if it's less than 12, then this means your body doesn't have the energy, doesn't have the ability to elevate that morning cortisol to where it needs to be so you can start your day. So this means that now officially, for some reason, your body has been under stress so much that it doesn't have the strength to be able to elevate cortisol during the morning. This is a very big problem. So actually, sometimes it's usually better to have high cortisol than to have low cortisol, because high cortisol means you still have the ability to keep making a lot of cortisol. But once that cortisol drops and you can't make a lot of cortisol in the morning or during the day, that means that you have officially depleted your reserves. And this is when people start to fall into burnout. So if you don't have a healthy cortisol curve and your curve now becomes flattened, all points are low, then this officially is burnout. You have officially depleted your metabolic reserve. You are no longer being able to produce cortisol to keep you going. And this is a burnout syndrome. And this now is a major problem. It affects all major biological systems, and this has been linked to all-cause mortality. This is a very serious condition nowadays. I just want to remind everyone that cortisol is not the enemy. So don't look at cortisol as the enemy. It's a friend. It's a natural hormone that is there to guide us in living in very healthy conditions. We hadn't been paying that much attention to testosterone for a very long time. And especially, we were not paying attention to testosterone in women. It's a very important androgenic male sexual hormone, which means it's anabolic. It helps with growth. It's the hormone that helps with building muscle, building bones, growing. It's what helps men become androgenic. But interestingly, women also make testosterone. They make testosterone in their ovaries and in their adrenal glands. Why is testosterone so important? Because it's that hormone in charge of vitality, energy, drive, it's stamina. It's what helps us to rebuild, helps with that resilience, to take a hit and keep bouncing back. When it comes to ranges, as we've been talking today, the reference range of a male testosterone level is very broad. And this makes things very complicated because you can have quote unquote healthy, normal ranges of 200 nanograms per deciliter, and sometimes they can go all the way up to 900. So this is a big range for a testosterone hormone. That means that any man who has 800, 600, 700, 800 nanograms of testosterone supposedly is normal, like the man that has 250, 300, 400 of testosterone. It's not a competition, but it's very important to understand that you always want to have healthy on the upper limit. And the same is exactly the same with women. Women have very small ranges. They go from sometimes anywhere from 15 to about 75, sometimes a little less. But you always want women to be on the middle to the higher end of the reference range. And this creates a higher, a better, a bigger impact of metabolism thanks to these healthy testosterone levels. I see this, we see this now more and more every day. Scientists have seen that there has been a very significant drop in the last decades in the testosterone production in men, which means now, just to give you an example, a 40, 45-year-old man doesn't make the same amount of testosterone nowadays than a 45-year-old guy used to make when he was in the 1980s or in the 1990s. So today, what would be considered normal is a man who has low testosterone within the range in the 200s, 300s, 400s, but is feeling sluggish, lack of drive, anxious, almost depressed. So this is a very common, more than ever, condition that we're seeing that is being considered normal. That has to change. So having natural too high testosterone is very rare to see. There are men who are very healthy and therefore still, even though they are in their 50s, 60s, or even more, still make very healthy testosterone levels. That is not a risk. There is nothing wrong with that if this is a natural production. If the levels are high because of supplementation or because of testosterone replacement, then that's another story. This is a question I get a lot from my patients. So you can test for both. Now, total is total. It's what has been traveling, and it's bound to proteins that transport the testosterone in the blood to all of those cells that need testosterone. And then what happens? Testosterone needs to enter the cell so that it can now complete its function. And so it separates from the proteins that are traveling, that are transporting it. And so now, of course, the numbers drop. And free testosterone is the more free, the concentrations, the amount that is going to be used inside the cell. The reason we test for LH and FSH, primarily LH, which is the luteinizing hormone. The luteinizing hormone is a hormone that we make in the brain up here in this area called the hypothalamus and the pituitary gland, and they travel in the blood, the LH will be sent from the blood to the testicles, and the LH will stimulate the testicles into making testosterone production. So very important to test both at the same time. If I have a patient, especially a male patient with low testosterone, is this coming from the testicles or is this coming from the brain? There are clinical ways of knowing this. It depends. Is the LH low or is the LH normal or optimal? That would mean the brain is working fine or not. If you have low testosterone but healthy LH, then probably your testicles are not being able to make healthy testosterone levels. Now, if you want to be really clinical, very specific, you can do a testicular ultrasound to see how healthy your testicles are, or you can do an MRI or a CT scan of the brain to make sure that the part of your brain, your pituitary gland, is working properly. So we now understand what healthy testosterone does. So by understanding what healthy testosterone does, we understand what low testosterone does. Lack of drive, I feel lethargic, I feel unmotivated, I feel kind of anxious, I'm losing muscle even when I go to the gym. There are many ways of clinically testing for testosterone deficiencies. Supplementing to enhance, to improve testosterone production is very, very hard. You have to have very minimal loss of testosterone production so that a supplement can actually increase your testosterone levels. There are very few that have been able to create any change in testosterone production. You need high levels of a very, very healthy, very good sourced supplement, and there's only like one or two who have really made a tiny difference. The rest really is about lifestyle and about testosterone replacement therapy. Vitamin D3 has become tremendously important around the world because we've always known that vitamin D is important for bones, but we were kind of stuck only in bone health. We then started to see that it also has to do a lot. It really impacts our mood. This is why Nordic countries with really long winters, where there's not a lot of sun, have more incidences of depression, of people having low mood. One of the latest ones that we've seen that has become probably one of the most important. After the pandemic, a lot of studies were done on vitamin D and the infection of COVID. And so we now know that vitamin D is a tremendous immune boosting vitamin. So we call this an immunomodulating effect, which means it strengthens your immune system tremendously. But the important thing is vitamin D has a lot of very important functions. So the list of vitamin D functions is growing and growing and growing. And this is why vitamin D3 optimization now has become more prevalent and more important than ever. So the majority of labs around the world still seem to have levels, reference ranges of anywhere between 30 and 100 is more or less where a lot of the labs continue to use their ranges. The optimal levels we're seeing are more kind of around 50 to 80. So not that 30 is bad or even 40, but as we have mentioned today many times, these are suboptimal. Vitamin D is not one of those, the more the better. Vitamin D, after it being too high, can become toxic. So it is important to measure the vitamin D levels at all times and always try to stick in this sweet spot of optimal vitamin D3 range. Yeah, so if vitamin D is low, you get sick more often, it's harder for you to fight the common flu, you know, your immune system is not as strong, it's not as robust, you can have lower mood, your bones are not as strong, it also helps and affects your cardiovascular system. So there are many things that will happen. So as I mentioned, having very high vitamin D can be a problem. We have to be careful. Vitamin D is a liposoluble vitamin. Lipo meaning fat. It's a fat-soluble vitamin. which means if we go too high, it can start to stick to your fatty tissue. And now, if it goes too high, it can become toxic. And this can cause toxicity. It can cause problems in the human body. Before starting to supplement with anything, ideally you want to test. Sometimes you can't really be testing all the time for all the things that you want to supplement, but vitamin D definitely, for me, is one of those biological markers that you do want to test for. Depending on what your baseline numbers are, you will know how to therapeutically dose that patient. It is very important to study for it, to see how much we need to give that patient, and then study again to see if you got to the level that you were looking for. So today we've mentioned some of the top markers that I like to look at, that we all should be looking at, but there are so many more. Now, what would be the connecting thread between all of these? It is very important that we understand we are not robots. Everything inside of us is interconnected by a lot of signaling pathways and by different routes. So all of these markers, all of these hormones are all talking to each other. They are interplaying and they are trying to have this great, amazing symphony that always keeps everything in balance. It is very important that we now start to understand that normal is very generic. Normal is the same for everyone. And we all know we are not the same. It is very important to go back to a more personalized, more individualized approach. And for this, we need to step out of normal and dive into optimal. So if you're looking at this and no one has ever tested for any of these, I think the best thing is to have assertive communication with your doctor. So if I was to be asked, what is the one test that everyone should be asking their doctor to have? I think a lot are already testing it. TSH, thyroid stimulating hormone, is right up there at the very top. Fasting insulin is growing more and more. I think that's one that gets missed a lot. I would definitely check insulin more than ever. And so these are the ones that you'd like your doctor to be checking more consistently. So if I was gonna give you one takeaway from all this, is it's definitely not about one thing. It's not one marker, it's not one hormone, it's not one vitamin. It's about the big picture, which means lifestyle and how that impacts all of these very important markers. Hope this helped, hope you liked it, and if you have any suggestions, any comments, any questions, feel free to share. See you on our next conversation, see you on our next podcast. Thanks for watching.